Welcome to Adapt NCLEX. This video is designed to help you master physiological adaptation questions in the nursing school and the NCLEX. They're challenging, but look, I'm going to make it easy. We're going to use common sense because we're going to think like what? A nurse, apply safety, and pick an answer that is what? Less invasive. Let's get to it. 13th question. Easy approach, common sense all around. Which statement by the client indicate correct understanding? That means the patient understand what is going on. And nurse is providing teaching to a client with what? Emphysema. Go for the buzzword. Our buzzword is emphysema. I underline emphysema. Saying what? Correct understanding. That's all. I'm going to focus on those two words. I inhale longer than I exhale to clear my lung. Bring your content. I blow out slowly like whistling during breathing. I perform off coughs frequently to clear secretion. I will drink a lot of water to break up secretion. I said common sense, and I'm going to show you. Don't struggle. Those are my buzzwords. Emphysema, correct understanding. Then bring your little content. Emphysema, you know the major problem is what? Air trapping, air trapping, air trapping. That means every answer choice, it has to be air trapping. If you choose anything other than air trapping, it's wrong. What do you think? I inhale longer than I exhale to clear my lung. You're going to trap more air. You should exhale longer. I blow out slowly like whistling during breathing. Oh, blow out slowly, that means you are extending your exhalation. I perform off cough frequently to clear my secretion. I said air trapping. Off cough is not air trapping. I will drink a lot of water to break up my secretion. Same thing, trapping you. I said air trapping. You see how we apply our content, good old common sense saying, hey, I know it's air trapping. Any answer that does not say air trapping, I'm not picking you. Therefore, if I'm whistling, I'm doing what? Pair sleeping. And this pair sleeping will prevent air trapping. Therefore, what is my answer? Number 2 is the right answer. This is how you answer physiological adaptation question. Always think about safety, always think about least invasive, and think like a nurse. And that's what we're going to do the next 9 questions. And I want you to stop the video, try to answer it on your own, and see if your approach is helping with the way I'm telling you to answer the question. Whether in your nursing school or you're taking the NCLEX. Once again, how do you answer question? From the back, which action should the nurse take first? First action. A nurse is caring for a client who arrived in the PACU 30 minutes ago. There's a reason why, there's a time. I will underline it. Patient just had surgery. The client eyes are what? Closed? Morning was what? 88. What do you think? What the hell buzzword? Like I said, we have to use some common sense and critical thinking at the same time. 30 minutes. Surgery. My eyes closed. I'm mourning and my SAT is 88. Do you think I'm in respiratory distress? Think like a nurse. You've been in the PACU before. When patients show up 30 minutes after surgery, how do they look? This is exactly what they look. Therefore, you're going to pick an answer choice that is invasive? No, expected finding. Patient just had surgery. Anesthesia is all over the place. Therefore, and the question says, first thing, that means the least invasive you can do is what? Apply oxygen, reposition the head, notify the surgeon immediately, increase the IV fluid rate. The reason why patient SAT is going low is what? This is the reason why. It's because you just had anesthesia. Their airway obstruction, they sedated, right? Their tongue is relaxed. Therefore, the only thing you can open the airway is to reposition them. There is several maneuvers. Chain lift, jaw thrust, Whatever you're going to do to improve their oxygenation is going to help them. But if you put oxygen on them, it's not the right thing. Notify the surgeon, it's not the right thing. Placing IV fluid is not the right thing. Therefore, we're going to reposition the head. Repositioning is going to improve the oxygenation just by changing the position of the airway. And that's the right answer. Which hematological finding is consistent with chronic hypoxia? Look, don't run away from it. This is a good old, you know this, but I will show you how you know. And next, review lab for a client with COPD. What do you expect? The VBC of 15,000, platelet of 120,000, what? Hemoglobin of 7, and hematocrit of 55. Go back to the buzzword. Think like this and say, look, who is a COPD patient? Chronic COPD patient. Chronic COPD patient has retention of what? CO2. Therefore, they have what? Respiratory acidosis. If you have respiratory acidosis, what do you think? You have too much acid outside, your body pushes acid inside the cell, and then potassium come out. Therefore, what does it lead? Hypokalemia. But what? Another thing your body will do is what? It will stimulate what? Erythropoietin because of the hypoxia. In the process, your VBCE doesn't change, but what is going to change? RBC and your hematocrit will increase. Your hemoglobin will increase. Therefore, you have what? Polycythemia vera. And what does that mean? Your hematocrit goes up. Your hemoglobin goes up. It does not go down. So there is no anemia. There is no leukocytosis, and this platelet is normal. And therefore, chronic hypoxia leads to what? Erythropoietin secretion, in the process, polycythemia vera. And what does that happen? Your hematocrit go up. Number 4, what is your score right now? I need you to stop the video because this is a critical thinking question, common sense, using strategy to answer physiological adaptation, NCLEX practice question, NCLEX review question. And we're going deep dive into the way you can just step back out of the question and try to figure it out. Which electrolyte imbalance should the nurse suspect? Test taking strategy. I said electrolyte imbalance. A nurse is caring for a client with what? Severe pancreatitis. The client reporting what? Tingling around the mouth. Your buzzword is what? Severe pancreatitis. And reporting tingling around the mouth. What electrolyte causes tingling? 1, if you don't know. 2, you say what? Pancreatitis. It causes what we call saponification, like soap formation. And this soap formation, what does that do? Absorb calcium. It leads to hypocalcemia. And that's the signs and symptoms patient is showing. Even if you don't know, look at it. Hypokalemia, when it happens, your things goes up. Therefore, you have diarrhea, right? But hypokalemia, but most of these symptoms, what does it do? Muscle spasm and what? Cardiac dysfunction. Tingling around the mouth is mostly what? Hypocalcemia or hypomagnesemia. Therefore, our right answer is number 3. But just know that pancreatitis causes fat saponification, in the process leading to hypocalcemia, and the patient's signs and symptoms are consistent with severe pancreatitis. That's the question I want you to be comfortable answering. And this is an example of where I said safety, least invasive, and think like a nurse. Practice question on endocrine. And nurse is caring for a client with what? Exophthalmos, related to what? Grave disease. You see the way they ask the question? They focus on one thing and they tell you. So the key aspect is exophthalmos. That is the key aspect that you're going to focus to answer the question. Now, come back and say common sense. What does that mean? Your eyes are popping out. So encourage the client to avoid eye movement. Would you do that when the eyes are popping? Is it good? Advise the client to restrict fluid to reduce swelling. You think when it reduces fluid, the swelling will go down? Teach the client to keep the head of the bed elevated during sleep and instruct the client to limit iodine intake. Look at what I'm going to do. I'm going to break the question down Answering questions using common sense. And you say, look, exophthalmos, I don't know what it is, but I've seen a video before, a picture with the eyes feel like it's popping, right? This is associated with grave disease. If you avoid eye movement, the eyes get stiff. It's a bad thing. Should be moving. Wrong. Advise the client to what? Restrict fluid. It causes dryness. So we want the eyes to not to get dry. That's why we use eye drops. If you restrict fluid, it's not going to help. Teach the client to keep the head of the bed elevated. These keep their head up and decrease edema from the eyes. Instruct the client to limit iodine. It's a good answer. Common sense tell you, look, the question say exophthalmos. This is the teaching overall for grave disease, but not specifically for exophthalmos. Therefore, number 3, we got to raise the head of the bed and help with that. Exophthalmos causes what? Eye irritation, dryness, and risk of cornea injury. So you tell them to use a patch at night. That's the teaching you provided. Number 6, I've already explained this, but this will go over it again. Which electrolyte finding is most likely, and let's review the lab results of a client with what? Severe emphysema. This is test-taking strategy. This is content NCLEX review question, and I like to deep dive into the critical thinking and the pathophysiology of the disease. But you step back, you say, common sense. We can use it to answer this question. We don't need to know all the details, but we can figure out a little bit. And we talk about severe emphysema, and you know it's a COPD patient. It's going to lead to what? Respiratory what? Acidosis. You get rid of the acidosis by exchanging potassium with H plus ion. How does that happen? The cell push H plus ion in and potassium come out. Therefore, any patient with what? Respiratory acidosis will have a compensatory what? Hypocalcemia. And this is the answer. Just know this content, but whenever you think about it, that's the application of that. And so that's the explanation regarding hypocalcemia. Number 2 is your right answer. A client with fractured femur develops sudden shortness of breath, tachycardia, and petechiae of the chest. What is the priority action? Step back, ask yourself, what is this? There's a key word in it. I always say, go back to the buzzword. Fracture of the femur, shortness of breath, tachycardia, petechiae. This is what we call fat embolism. You have long bone fracture. Therefore, anything associated with the respiratory problem is what? Fat embolism. Now look at it. What do you want to do with the fat embolism? Well, I need to prevent any more fat embolism. But you intubate the patient, you give them oxygen, you notify the air care provider, or place them in a triangular bed position. Patient is desaturating. You want to put your head down. Number 4, wrong. Notify the air care provider. I said safety, least invasive, think like a nurse. Is there any least invasive thing you can do as a nurse? Common sense. Apply high flow oxygen via non-rebreather versus prepare for intubation. Which one is least invasive? And you don't have to waste time. You don't even need orders to do that. Patient is in trouble. Sudden onset shortness, breath, tachycardia, petechiae due to what? Fracture femur. Hey, I need to give you oxygen to improve your oxygenation. It's much better than waiting for intubation. We may have to intubate you, but right now, you need some oxygen. And this is caring for a client after craniectomy. It doesn't matter. Edge surgery, brain surgery. The client suddenly become restlessness, bad problem. Unequal pupil, bad problem. Vomiting, bad problem. If you collect all together, having head injury, ICP issue. What would you do? Increasing ICP in the patient who just had surgery. What would you do? Do you call the surgeon? Do you raise the head up? You give them antiemetic or perform a full neurological assessment? Full neurological assessment is not going to help you. They're not vomiting. So why would you give them antiemetic? Is there anything you can do less invasive? Calling the surgeon is not going to help you. Just raise their head up, and this is going to lower the ICP. It's much better. 2 more questions. I know you got it. A client with what? History of seizures is scheduled for discharge. It's going on. Which instruction is the most important for the nurse to include? Think about it. Think about this question. Most important. Avoid alcohol and fatigue. Is it important to prevent seizure as you send this patient home? Keep your seizure diary updated. Is it that important? Always wear your medical alert bracelet. Is that important? And take showers instead of bath in order to prevent trigger. Showers are cold. Bet you will trigger your seizures. Now you left with 1, 2, 3. Avoid alcohol and fatigue. It's very important. Keep your seizure diary updated so that you can know the triggers. Always wear your medical alert bracelet. This is a concept. If I know who you are, any small thing, I will intervene. This is why people with comedy, we want them to wear alert bracelets so that when they present to the emergency room, I know I cannot just stop them because they're on comedy. Same thing. This patient, if the patient has a band on, he said, I'm a seizure patient. I know when I see them jerking, I'm protecting them. So you're having this bracelet on provide immediate saving communication to others. Therefore, the right answer is number 3. This is the hardest question of 4. But you got to step back, think like a nurse, provide safety, and then deal with the least invasive mechanism. And the last question, mother calls a report a child has ingested an entire bottle of acetaminophen. What should the nurse do first? You let the mother call poison control, give the kid a milk, instruct to induce vomiting, or ask the mother to do what? Find out what is going on with the patient. The principle for fundamentals of what? Injection is what? You got to know what they injected before you can treat it. We already know they're on acetaminophen, but we don't know how the patient is doing. Is the patient now sleepy? Is having respiratory distress? Otherwise, we'll call on somebody else. So first, you got to assess the patient and figure out whether you need to go at poison control or 911. Telling the mother to give the milk is the problem. Inducing vomiting will worsen the situation. If I'm not going to call the poison control test-taking strategy, then I got to ask the mother how the baby is doing. Therefore, number 4 is the right answer. 10 questions, English practice questions, physiological, using good old common sense. Thank you for watching. If you like this video, put a comment, tell me which question bothered you. And thank you for watching. Subscribe to NCLEX for more content like that. Good luck.